Hi, everyone. I'm Lindsay from Artifact, and today, One Cancer Place introduces you to the poignant story of Carol Koch. This is one in a series of personal stories that provides a peek into the authentic life of a cancer patient. We hope that you find the magic in these unique stories because each of these lives is lived to the hilt, in service for others and in deep gratitude for survival.
Okay, my name is Carol Koch, and I have Lynch syndrome. Lynch syndrome is something that you're born with. It can be passed on by a parent, and it's basically the loss of part of a gene, and it's a very important gene that does corrections that keep most people from getting cancer. So without
Mm.
that correction mechanism, I and other people who have Lynch syndrome are at a higher risk of getting multiple kinds of cancer.
Wow. Okay. So Lynch syndrome is a congenital syndrome.
Yes,
And how old were you when you found out that this is indeed what you had?
that's an interesting story. My first cancer happened when I was 28 years old, and I had colon cancer. It was a situation where it was very difficult to diagnose. I ended up in the hospital with no clue of what was causing the symptoms I was having.
Hmm.
And after about 3 days, a surgeon came in and said, I think we need to do an exploratory surgery. And he found this large tumor, size of his fist, in my colon.
Wow.
And so he took out a section of colon, and that was in 1978.
Wow.
So at that time, the industry just didn't know very much about Lynch syndrome. The only thing they knew is that there were families that tended to get colon cancer. And so from that knowledge, they recommended that I have a colonoscopy every year, which I have done for over 40 years because I'm now 71 and that first cancer was when I was 28.
You said that Lynch syndrome makes you susceptible to different forms of cancer. So, and then you said that your first time being diagnosed with cancer was when you were 28 and it was colon cancer. Are there other cancers that you've had to deal with throughout your life?
I had a very long run with no cancer except for skin cancers, which are related to Lynch syndrome, uh, but they're pretty easily taken care of as long as you stay on top of it and get an exam every 6 months. But in 2015, I was diagnosed with urothelial cancer, which is cancer of the ureter. The ureter is the tube that goes between the kidney and the bladder. So that happened in 2015. I had a ureterectomy, which is removing a big portion of the ureter and then reconnecting the bladder by sewing it to the psoas muscle. And that allows them to be able to reach what little bit of ureter they left.
That seems like a very involved process. What were the resources that you had at the time and, how was this all explained to you?
Well, it happened on a weekend. I noticed a lot of blood in my urine. So I went immediately to an emergency clinic, not thinking that it was anything to do with cancer. I, I was just shocked to see it, didn't know what it was. And
Mm.
they diagnosed me with a kidney infection and gave me some medicine. Well, the very next day, I basically collapsed. with pain and had to go back to the hospital, or I went to the local hospital, and it took them a very long time, 23 hours, to just get the pain under control. And once they did, they let me know that they had found a mass and that it was malignant. So after I was released from the hospital, I went to Denver to the University of Colorado Hospital and started working with the urologic oncology department. And they recommended that I have the surgery, the ureterectomy, which I did. But about 6 months later, during one of the routine surveillance exams, they noticed that 2 lymph nodes were enlarged.
Mm.
So I had another procedure to try and check those 2 lymph nodes, which was non-conclusive, not successful. And I was very lucky that I went to the oncologist I went to, not the surgery oncologist, but the general oncologist, urologic oncologist, I think is her title. And she recommended another surgery, which ended up being a really big surgery, but they removed all the retroperitoneal lymph nodes, which are behind your stomach, behind your intestines. So it requires a very long incision and a lot of hours of work to get to those. But they removed them all, and they found cancer in 4 out of 31 lymph nodes. After they removed those, I had chemotherapy, and that ended in 2017. And I'm still no evidence of disease.
So you said that when you first found out about Lynch syndrome that there wasn't very much known. What are the things that you've learned in the past 40 years of living with Lynch syndrome? And what are some of the resources that you've been able to reach out to or develop over the years?
Well, I've learned that it doesn't just affect the colon, which is what I thought for many years, that I was at risk of future colon cancer. But it turns out that there's an incidence of many other kinds of cancer, one being in the female organs. So
Mm.
I've had a full hysterectomy where they removed everything, including the ovaries. That's when I was 30. So I guess they knew at that time that it had a tendency to spread there. But now the more I learn, it can spread to the urinary tract, to the stomach, to the small intestine. And then, of course, if it shows up in any of those places, then it can metastasize further, which is what happened to me with the urothelial cancers. It metastasized to those lymph nodes, which put me at stage 4. But I didn't know enough about cancer at that time to realize they can treat and potentially cure stage 4. I thought that was it, what he told me, stage 4. So I've learned that it's not as uncommon as you think. The problem is that a lot of people have it and don't know they have it.
Yeah.
I've learned that there's a big supportive group of people on Facebook. There's many other support groups. The hospital I go to has a lynch professional who is their primary doctor to take care of patients with Lynch syndrome. I've learned that having a colonoscopy every year, as difficult as the prep is a really important way to manage this because I have had precancerous polyps removed that eventually had the potential to go on and become malignant tumors.
You mentioned some of the support that you found through Facebook and other groups. Can you talk a little bit about the way those groups helped you through your different diagnoses and maybe some advice that you found there or, you know, connections that you've made there?
Well, it's pretty amazing to have people who sort of cheer you on when you do get a good test result and who are there to support you when you don't. And people share tips about prep, which is kind of done in, with a lot of humor because prep for a colonoscopy is not fun. But people find ways to, share where to get banana popsicles or that it's okay to eat gummy bears as long as they're not red. Um, just little things like that. And then I actually had someone come and meet me at the hospital one time when I was attending an appointment. And she kind of wanted to meet my doctor and she wanted to meet me. So I let her sit in on the visit. And so that was nice to meet her.
Can you tell me about One Cancer Place and how it sounds like their goal is to foster more interactions like the one you just described?
I first discovered Colon Town maybe 3 years ago. And I thought it was really creative the way it was set up on Facebook with all these different places that you could go for information and advice. It was set up like a little town with a town square and various shops and or places to go to find out specifically what you're dealing with because and that was dedicated to colon cancer. And people with colon cancer have everything from living with a colostomy bag to having specific genes that might be able to be treated. So all these different areas of interest were interesting, and they happen to have one for Lynch syndrome. So that's where I would go and learn things about Lynch syndrome and the genetics of it. And then one of the main organizers of that group started One Cancer Place. And it turns out she lives in Denver, and I live in Longmont, which is about 35 miles north of Denver. And so she invited me to come to her apartment and meet her. And I spent quite a lot of time having lunch and just chatting and getting to know about her objectives and her enthusiasm about starting an organization that helps not only colon cancer patients, but all cancer patients.
How would you like One Cancer Place to ease the burden of finding out that you have cancer and moving forward through the plethora of information, misinformation, old information, and lack of information?
Well, I think having a one-stop place to go is really going to be beneficial for people because I believe what they're doing is collecting lots of resources and information that already exist, but are kind of scattered all over the place. So this will be one place where you can go and get information that's relevant to your exact situation. And also building connections between people. Erica Brown is the primary director of it, and she asked recently for me and a few other people to connect with a newly diagnosed person. And so we did. And that person was very grateful for the welcoming and the information that we were able to share with her.
That's amazing. I imagine that a lot of people listening to this are dealing with cancer, but also maybe the people who love the people who are dealing with cancer might be listening as well. What advice do you have for the loved ones of people who are going through something like this? What things could they do to help ease this difficult time?
Well, everyone's different. I think some some carers could be really interested in the science behind the type of cancer and would be able to find either the information there or links to the information. Other people probably need emotional help for themselves because it's very, very difficult to be a caretaker of someone who has cancer. And so finding a supportive, welcoming group, I imagine, would be very helpful. So I think it could cover a lot of aspects of helping caretakers. Some caretakers basically are on the sites learning everything they can learn about their partner's cancer. And other people are not inclined to do that, but they're helping their partner by buying groceries and cooking dinner and things like that. And it's exhausting. So having someone to share their what's going on in their life, I think is important.
Yeah. Is there anything else about your specific experience that you would like someone who might be going through something similar to know or to share with them?
Yeah, urothelial carcinoma in the case of Lynch syndrome does not have a good surveillance plan. And so if you have Lynch syndrome, you need to do more than just the annual urinalysis, especially if you have MSH2, which is the gene deletion that I have. And if there's been any urinary tract cancer in your family, then you need to take it upon yourself to find a doctor who will do more in-depth screening than just, like I said, just the annual urinalysis.
Where could someone who might need to find a doctor willing to do something like that, where would they start their search?
I guess you would start with your urologist. If you don't have one, get a urologist and explain to them that you've had this happen in your family, and so you need to be followed more closely than other people. And if that doesn't work, then go to a teaching hospital, like a university hospital, and work with their urologic oncology department and insist that you need better surveillance than what is standard today.
Yeah. Well, looking at your experience now from having clear skins and being in good health, what advice do you have someone who might have just gotten a stage 4 diagnosis?
I guess I would say you need to have a conversation with your doctor about whether or not it's curable or if the goal is to have a cure, which in my case it was. So that's very different than I think most stage 4 cancers. So I can't speak to people who have a terminal stage 4 cancer, but if there's any chance that it can be there's some kind of a curable treatment, then I would travel to another state or whatever it takes to find a doctor who will work towards cure. I think I was just very lucky because I saw two doctors in the same practice, actually. And one of them said, "Oh, we wouldn't operate because we would just be playing whack-a-mole." And then the surgeon sent me to the other oncologist, and she's recommended having it's called an RPLND, retroperitoneal lymph node dissection, which I don't believe is done very often, but that's what was recommended. And so far it seems to have worked.
That's great.
Yeah, it's really great. It's just, I think there's so little known about this particular form of Lynch cancer that doctors aren't up to speed on it. Many are not. So that's why I'm saying go to a university hospital where they have a urologic oncology department and inform yourself ahead of time about situations like mine where it actually worked. It didn't turn out to be whack-a-mole. Someplace like One Cancer Place where you can learn about especially obscure information that you wouldn't easily find elsewhere. Like me, what my situation, if someone else hears this, then they will know, oh, there is a surgery for retroperitoneal nodes.
Yeah, it sounds like the sharing of information from people who are going through it is one of the most valuable things in this community.
Yeah, I don't, I mean, I'm not saying every case is the same and that because it worked for me, it'll work for someone else, but it's definitely a good thing to know and to ask about and hopefully maybe be able to